Hello, everybody. Welcome to this webinar. My name is Lawlor. I'm one of the founding directors here at GBHI. I'm delighted to welcome you here. I believe there's about 170 people from 49 countries who have registered. So welcome to everybody. So we've got about 45 minutes today. And first of all, I'll cover some of the nuts and bolts about GBHI and the Atlantic Fellows for Equity and Brain Health program, which is delivered here at Trinity College Dublin and University of California, San Francisco. And then we're going to move to have an interview with two of our global Atlantic fellows, Lenisa Brandão and Mataa. Lenisa did her fellowship year here at Trinity College Dublin, and Mataa did his at UCSF. So you'll get a flavour from listening to the two of them about the experience at the two different sites. Then after the interviews, we'll move to a Q&A, and this will be your opportunity to ask questions. You can ask questions by selecting the Q&A icon in your Zoom window. So chat is not available on this webinar, so you have to put the questions into the Q&A and we'll try and get to them. I just want to let you know that the webinar will be recorded. Okay, so now I'll just move and just to give my presentation. Let me see if I can share these slides. Whoops. I hope those slides are being shared. So I'm just going to give you a quick overview over the next 5 or 7 minutes about the Atlantic Fellows for Equity and Brain Health for this applicant webinar. So I really want to start by acknowledging the founder of Atlantic Philanthropies, Chuck Feeney, who died 2 years ago. And I guess we're deep gratitude to him because as the founder of Atlantic Philanthropies, he's the funder for GBHI. And he had one idea that never changed in his mind, that was about using his wealth to help people. And it was really through his kindness and through his funding that the Atlantic Fellows for Equity and Brain Health and GBHI was founded. So GBHI is one of 7 equity-focused programs that Chuck Feeney Atlantic Philanthropies funded. So there are also equity programs on race equity, social and economic equity, and health equity in different countries, Southeast Asia and in the US, and also in a program on Indigenous health. So GBHI is one of those programs. So why was GBHI founded? Well, GBHI was founded because we wanted to deal with the wicked problem of dementia. And when you have a wicked problem of dementia, this is a very complex problem. You need a wicked solution. And GBHI is a solution that tackles the wicked problem of dementia. So GBHI, we founded 10 years ago in 2015, and we'll have our 10-year celebration in 2026. And it was founded to protect the world's vulnerable populations from threats to brain health. And so we focus on brain health across the life course. And the focus is on social determinants, on inequities, and the founding sites for GBHI are University of California, San Francisco, and Trinity College Dublin. Now, the mission for GBHI is to reduce the scale and impact of dementia in three main ways. This is to collaborate and expanding preventions and interventions, to share knowledge and engage in advocacy, and then through the Atlantic Fellows for Equity and Brain Health program, which we're talking about today. So up to 2024, from 2016 to 2024, we now have fellows in 62 countries, 266 fellows scattered globally. So it's, and we hope that we will have many more over the next 7 to 10 years. So in terms of the fellows who we are recruited to the Atlantic Fellows for Equity and Brain Health, these are early to mid-career professionals, and they come from diverse disciplines and professions and backgrounds and skill sets and perspectives. And really it's this interdisciplinary or transdisciplinary approach that is the wicked solution to the wicked problem of dementia. So let me tell you a little bit about the program overview. It's a 12-month full-time paid fellowship at University of California, San Francisco, or Trinity. Fellows experience site-specific but also cross-site activities. They develop core competencies in common and leadership skills across the two sites. And they share touch points, including an in-person annual conference, usually in May of the fellowship. And at both sites, they receive a certificate for equity in brain health that's awarded by both UCSF and by Trinity College Dublin. The learning experience, there are four pillars. There's mentorship, and I think when we get to speak to Lenisa and to Mataa, we'll probably hear about mentorship. There's leadership and skills training. At both sites, fellows experience the clinical and lived experience, where they actually get to talk to and see what the lived experience is for people living with dementia, but also for caregivers and care partners. And then there's the taught curriculum. Now, this is a transdisciplinary curriculum because we have fellows coming from many, many different disciplines and professions. And the material is integrated across these different disciplines. And we have key topics which include, obviously, dementia and neurodegeneration, diversity, equity, social determinants of health, ethics. A big focus is around creativity and arts and creativity for brain health and health policy and economics. We use case-based learning, and there's different modalities for different learning styles because people are coming from different starting points. So the different modalities around experiential learning, peer learning, didactic learning, and a major focus is around collaboration. And we have a series of workshops, seminars, salons, and fellow-led sessions. Some of those are site-specific, and some of those are cross-site later in the year. I want to tell you about an important aspect of the program is the pilot awards for global brain health leaders. This is a very important part of the program. Every fellow who comes to the program has an opportunity to apply for pilot funding. And again, we may hear about the pilot funding and the projects when we talk to Mataa and to Lenisa. These are small-scale projects, activities or studies to advance skills, knowledge, and they focus on delaying, preventing, and mitigating the impact of dementia. And these pilots are really important because they support the leadership development, the transformation of the fellow, particularly when that fellow returns back to their home environment, their home country, as they try to transform and improve outcomes in the area of brain health and dementia prevention. These pilot awards are funded through GBHI, but also through the Alzheimer's Association and the Alzheimer's Society UK. Very importantly, after graduation, fellows become part of a global alumni program. So it's a lifelong fellowship. You become a fellow for life. So fellows remain connected with one another, and they're very much supported by the alumni leads in the program. So our fellows are networked. Fellows are networked across the GBHI community, but they're also networked and linked into this larger Atlantic Institute community. At the beginning, as I mentioned, we are part of 7 global equity-focused fellowships. So there's a very strong network within the Atlantic Fellows, but also with the Atlantic Fellows for Equity and Brain Health, but also connected to the larger global Atlantic Fellowship movement. So here you see the journey of the fellow. The fellows arrive, they are assigned their mentor, they begin to develop their training plan. During the year, they develop a lot of experience as part of GBHI at both UCSF and at Trinity College Dublin. They build knowledge, they develop their leadership skills, they begin to collaborate with fellows at their own site, but also cross-site. Then they begin to transform as leaders, they expand their knowledge, they identify opportunities and share ideas, and then they return to engage in their home communities using the knowledge, the skills, the leadership skills that they have developed, and hopefully over time, as part of this networked alumni community, begin to change the world and to change the narrative around brain health and dementia prevention. So I now want to move to the interviews, and we're going to have an opportunity to talk to Lenisa Brandão first, and then Mataa. So Lenisa Brandão is a speech therapist from Brazil, and she's associate professor at the Universidade Federal de Rio Grande do Sul in Brazil. Her work focuses on improving access to dementia care in low-resource settings by promoting culturally sensitive communication strategies and strengthening caregiver support. I think one of the things that stands out for me from Lenisa, and she did her fellowship training at, at Trinity College Dublin, was her interest in clowning. I think we're going to hear about clowning. So it's this is a fellow speech therapist, academic, but she has an interest in using clowning to help with communication skills for people who've had stroke, people with dementia. And hopefully we'll get to talk a little bit about your pilot project in due course, which involves the assessment and the evaluation of clowning in people who had post-stroke, who had language difficulties. So, Lenisa, first of all, maybe could I ask you what encouraged you to actually join GBHI in the first place? Why did you apply?
Good afternoon. Thank you for having me here. So what encouraged me? I was looking for a space where science could coexist with sensitivity, deep understanding, and I was starting a new phase in my career where I was reaching out for innovative interventions that could move not only the language as we think about it usually, but also communication as a whole with the whole body. And this is a very different area, which, especially when you think about clown therapy, it's not an easy way to start to move when you're in going into your mid-career phase, and usually there's a lot of traditional approaches in biomedical science. So when I heard about GBHI and its openness for creativity and brain health, it really made me feel hope about getting into this space and being able to talk with people who were really looking at these perspectives as something valuable. And I found that. So I'm really, really grateful for it.
So it sounds like, you know, you were changing the way you were thinking in terms of your approaches from an academic and a clinical point of view, and GBHI gave you that opportunity. So can you tell us a little bit about how welcoming was GBHI in terms of embracing clowning and the use of clowning as a therapeutic modality for people who have problems with brain health?
It was a very wonderful receptivity that I found, and being able to do also some courses that GBHI gave me the support for it when I was in my fellowship. So I was also being able to do the clown courses with very important clowns around in Europe.
Mhm.
And the fact that I was also stimulated to offer a workshop in Trinity College also showed how open GBHI was to this approach.
Okay. What I mean, you were in a class or quite a mixture of people coming from different disciplines, different professions, as I was talking about at the beginning. You know, you had scientists, you had doctors, you had psychologists. You had quite a mix. So what was that like?
That's actually, I think, one of the best parts of GBHI, the interdisciplinarity of the program, and the unexpected friendships that we make from people with people from all over the world. So it's an opportunity to talk with different cultures and also different backgrounds and different perspectives, theoretical, scientific perspectives, and to gain an understanding that is not only by reading, but with talking, deep listening to what people really want to us to understand from their areas. So that really opens up conversations and dialogues that continue going on this day for me.
And in terms of, preparing you for when you went back to Brazil, um, in terms of, leadership and skills, I mean, can you comment about that, how it helped in terms of what you had to do when you went back home?
For sure. When I came home, I came with a baggage that was very reassuring of what I have embraced with clown therapy, but also with all the other important points. So I started to give classes in public health also, because this was an area that opened up for me. Talking about equity really came to my heart. And the fact that I was able to get the pilot with the funding, because
Mhm.
we had this application for the funding of the pilot, and I did that. And then I was able to do this research about clown therapy and work on this study, which was a fantastic experience with an interdisciplinary group of people working together with me. So um, I can't begin to tell you how much I grew also after this experience, the 1 year experience. It really continues going on, and I'm very happy that it's a lifelong um, fellowship.
So maybe a couple of questions before we end. I mean, one was around maybe to tell us a little bit about your study, because this was an intervention study where you used clown therapy in people who had, I think, post-stroke aphasia, right? And could you just
Exactly.
very summarize the findings? Because that was I was quite a complex study, a challenging study, but very, very interesting study and some very nice findings, right?
Yes, we had 26 people with expressive aphasia due to stroke. And these people, they did a 5-month intervention with actors who were experienced in clowning. And we made a program with clown therapy. We adapted the clowning techniques and philosophy to work with this clinical group. And we did this for 5 months, and we checked for improvements in quality of life, functional communication, and different language skills. So we found that all three of these aspects improved significantly, and this was shown with statistics. So we had enough statistical power for this pilot study. It's a small study, but we were able to do this. And we found that it's that quality of life and functional communication, which were the focus points of the study, were improving a lot. But the
Mhm.
big surprise was that expressive language skills, so naming, repetition, and even the ability to conversate in a directed interview, improved after clown therapy. And we had plays going on. They presented for around 200 people. So this was also a way to change perspectives of family members, friends, and the general public about aphasia and about approaches such as this.
No, I've seen some of the videos and they're amazing. I mean, the fun that people are having, but also to show that there's real benefit in terms of outcomes. So, my last question to you is really around, I guess, the aspect of the issue of collaboration and connections. So, back in Brazil, I mean, do you feel that GBHI has helped with connections in Brazil, which is a very big country, or across the world? Just maybe a few comments on that.
For sure. One of the big parts of the program was focused in networking. So us to start developing relations with collaborators. And this was something that was very important, and that I was able to gather a team of collaborators. And also today we are still working together with article production, the fact that there was also mentoring, both in GBHI and in Brazil. So these really are specific characteristics of GBHI that help on with the development of the fellow.
Great, Lisa. Well, I'm going to let you go for a moment. I think there's some questions coming in for you, which we will get to in the Q&A, but I'm going to switch now to a different part of the world. We're going to Africa, to Zambia, to Mataa. Hello, Mataa. Welcome.
Hi, Brian. How are you? Hi,
Great
everyone.
to see, yeah, great to see you. And I guess we're switching now to Mataa, as a neurologist from Zambia. He works in a government hospital. And I think, Mataa, you were very much instrumental in founding the Zambian Alzheimer's Association. Isn't that right?
So I came to it. It was actually founded by someone whose father lived with dementia in a rural part of Zambia, but I joined the organization and I've had the privilege of working with the organization for the past maybe 4 or 5 years now, which has been a really wonderful experience.
Yeah, I think you're doing fantastic work there. And you spent your year at University of California, San Francisco, at the MAC, at the Memory and Aging Center. So, tell us a little bit about your experience at UCSF.
It was a really wonderful experience and opportunity. I think, like everyone who's going to apply for the fellowship will face, you do have the option of applying for either on the site. So I had chosen UCSF because it's aligned, I felt, more with the work that I was doing, and I really wanted to spend a lot of time in that setting. But being at UCSF for a year was a great experience as a neurologist. Really early in my career, being able to spend time with some of the eminent people around neurology and brain health, Bruce, people who've written the papers, the things that define how we approach brain health and dementia was really powerful, but also a lot of the other aspects of the work that I do in terms of community outreach. I think that was a very powerful part of the UCSF experience for me, learning what dementia care looks like in community setting. I think that really attracted me, and that was a big part of my enjoyment of my fellowship year.
And tell me a little bit about your experience with the cohort. I mean, people coming from different professions, disciplines. Was that challenging for you?
It was interesting. I think in a very enjoyable way. I think, like Lenisa said, I've come out of the fellowship with lifelong friendships and collaborations. But when you spend your entire life in a very clinical space, in a very regimented space, and then you're sitting around this table and you have musicians and poets and this really diverse group, and then you're trying to figure out, okay, how will this actually work? And then once you get into it, you say, okay, everyone brings such wonderful depth into the work of everyone else. As a clinician, I got the opportunity to listen and learn from artists, and now I am using, even if in my own small way, I'm looking for and incorporating art in the work that I do. I'm using music in the work that I do. I'm speaking more about the work that I do, which is something that we're not always great at as clinicians, as scientists. We're not always great about speaking about our work. But when you're in a room with people who speak and do this on a daily basis, you, whether you want to or not, you're going to pick up a few things from them, and that's you carry with you.
So that's interesting. I mean, I think I suppose everybody's creative in their own ways, and this help you sort of recognize your own creativity. But it sounds like the telling of stories. I mean, this is one thing that we learn from creatives, and I think I hear you say that you were able to tell the stories a little bit better now in terms of the communication. Is that right? Because of the experience with these creatives.
That is so true, and that's a bigger part of the work that I do. I think with brain health and dementia, especially, being able to tell stories gets us into the room. It gets people involved in the work that I do. So that has been a big part of my learning from the fellowship, being able to take part in activities like, for example, we did the hearsay project, where you get to interview and be interviewed, and being able to tell that narrative. And especially as we engage with people living with dementia, being able to tell their stories. I think when I'm sitting next to the Minister of Health in Zambia, I need to be able to tell him these stories and put faces to, it's not just a diagnosis, it's a person. So these stories are really, really powerful.
So I was saying at the outset in the presentation about, the wicked problem of dementia needs a wicked solution. I mean, do you think, again, having gone through it, do you think that experience is part of the solution now, the transdisciplinarity? I mean, in terms of how you see things now compared to before you came to GBHI?
Absolutely. That's I carry with me. I was asked to give a talk today at a conference for biomedical scientists, for example. And in my talk about brain health and dementia, diagnosis of dementia in Zambia, our current landscape and where we're going. And when I was asked to speak, I was like, what am I going to actually say to these biomedical scientists? They fix machines in our hospitals. But then I realized these are the people that will be important in driving policy to make sure that when we're asking for equipment, things like CT scans and MRIs are prioritized. So if I can speak to these biomedical scientists and help them understand what dementia is and the importance of neuroimaging, when they're sitting in those important rooms, they will more likely be able to prioritize and think about dementia. So you have to be able to speak to a broad spectrum of people, and the fellowship is really, really good at equipping you to have different conversations with different people, but driving towards the same goal of enhancing access to care and support for people with dementia.
So I just, again, maybe one or two last questions, because I mean, I think you've explained very, very well in terms of, I guess, how GBHI has transformed your thinking. And I guess you've given a great example today of how it's helped you kind of, I suppose, frame your conversation with these biomedical scientists. Um, is there anything else you think that stands out for you that you've learned from GBHI that's helping you in your day-to-day practice now as you try to transform services for people living with dementia in Zambia?
One of the things actually is about keeping it simple.
Okay.
I think sometimes we complicate when we're thinking about, oh, how do we approach this? We overthink things. But it's the small things. It's learning how to just being in a space where painting and drawing or just listening, just the power of conversation, of listening. It's being able to use because when you do a fellowship like this, coming from a place like Zambia, where we are very limited, but then you go to a place where everything's there, it's very easy to be overwhelmed with
Hmm.
the access to everything. But even in that, you can say, I might not have all of these things, but it's not about the big equipment. It's about the principles and what small things can I do. And that has been a big part of what the fellowship does for it. It makes you look at your own environment, identify what is in your space, and begin to think of how do you use what is already in your space.
Great. Okay. Well, I think we'll leave the interview at that, the conversation at that, and maybe go back to allow people to ask some questions through the Q&A. I'm sure there are going to be some questions for you, Mataa, and we know there's some questions from Lenisa. So if we could move back to the Q&A then and just see what we have here. Just looking here at some of the questions. So one question here for you, Mataa, about besides the storytelling, which I think you've explained really, really well, what other leadership skills were you able to pick up from the fellowship?
Quite a lot. I think one of the things that happens quite early on is um, the fellowship helps you understand who you are as an individual and as a leader. What type of leader are you? when you come into a space, it's easy to see, oh, people have published so many papers and I have no publication. So the first week or so, you kind of shrink into yourself, but the fellowship is very good at opening you up to say, listen, you are here because you have something to bring to the table. So that was something that was very important for me, being able to help me find myself as a leader and my role in leading others. I think that was a big part of it. Yeah, I think that was very important for me.
So, I mean, it was confidence building. I mean,
Yeah.
I mean, you became even more self-aware. Obviously, you discovered your creative skills, but also your leadership skills. So, and on the topic of creativity, there's a question there for Lenisa about what other creative modalities did you experience or were you exposed to at GBHI? You talked about the clowning, and I think Matt has talked about storytelling, but what other creative modalities did you explore or get exposed to?
I would stress storytelling also, like Mata, because storytelling was an important part of not only with rediscovering who we are, like Mata said, which was a very important thing to discover our own narratives and how we would build this into our identity, our professional identity, but also the stories told by the perspective of different areas, like anthropology, for example. When we have our fellows coming from these different areas and telling their stories with such backgrounds, we start to see the complexity of this tool, which is storytelling, in much more beautiful and let's say a lot of knowledge coming out through art, through the art of storytelling. So I stress storytelling with this, but of course I had, like Mata mentioned, colleagues that work with music also, which was a fantastic experience to just go with them and see them doing their work, like Jane Bentley from Scotland,
Yeah,
being able to be with her in the hospital, and just the way she shared her approach with us, and we did music together with her because she was very generous in that way. So yeah, the art is in the we breathe that together with science.
So, I mean, I think the music, Jane was a drummer. Then you have the dance, filmmaking. I mean, I think we've seen many, many different creative modalities depending on the court that you're in. But I agree, I think, with both of you that storytelling is key. Whether you're telling a story through music, dance, or through film, and that skill is so important. Um, Now, there was let me see. There was another question here I thought that I thought we would be able to get to, and let me see. The question really relates, I'll paraphrase the question, was really whether if you're a neurologist or a psychologist, and, are you able to be, I suppose, individually focus on what you really need to focus as well as other things, or do you have to generalize? So I guess, let's say if somebody is coming to the program, maybe Matt, I might ask you first in terms of, let's say you're a neurologist. Now, obviously, can you focus on your neurology in addition to getting other exposures, or do you feel, or does it get kind of watered down, shall we say?
No, not watered down, not in the least. It's concentrated, if anything. Um, Much as the fellowship has a lot of structure, and the structure is really designed to give all of us as fellows exposure to different aspects. So the clinical lived experiences give you this really wonderful opportunity to experience the deepest neurology you could ask for, the deepest psychology, neuropsychology could ask for, pathology, if that is where your interest lies. But even in that structure, there are so many opportunities for you to create other opportunities for yourself. For example, I have an interest in neuropalliative care, so I had opportunities to engage with faculty at UCSF around neuropalliative care. I had opportunities to engage very deeply in the community outreach aspects of that because that's an area that is of interest to me. So you have all these wonderful experiences within the structured clinical lived experiences, and then you will get exposed to so many wonderful people during the fellowship, and everyone was so receptive and very welcoming. When you express an interest, they would connect you to, oh, you should have a conversation with this person, you should have a conversation with this person, and you build from that.
So, I mean, there was a broadening of your experience, and the mentors were able to connect you, but you were able to still focus on what you needed to focus on, but get the much broader experience as well. As I say, the structured program. Again, Lenisa, would you say the same thing at Trinity?
The same thing. We are always very stimulated to talk with different people that as long as we express our interest on a certain area, then lots of opportunities open to talk with people, to learn more about it. So we have time for diving deep into our own interests, apart from learning the same things together and being able to go through the same journey. We have this space, and it's a very rich space to grow into the interest areas that we have.
Okay, but a couple of other questions. I mean, and I guess it relates to what both you and Matt were saying about your experience with mentors. Everybody who comes into GBHI, they're assigned a mentor, and obviously they try to select the right mentor for you, usually get it right. Tell me a little bit about your experience with mentorship. I'll maybe ask you, Lenisa, first, and then Mataa. So, how does it happen, and what was it like?
We get to develop a relationship with one of the faculty members that is about improving our pilot proposals, and to think about our areas and the journey that we're gonna go through during the whole fellowship and afterwards. So it's a very good thing to have that we have also the liberty to talk with the different faculty members that also always behave as if they're a kind of your mentor also. So you feel very welcome in that way, that you have a faculty member that is taking care of you individually, but you also can always have conversations with the faculty members that have something to offer in a different area. So it's a very good approach to have in terms of learning and to deepen the project and to perfect it.
Great. And Mataa, anything to add about your experience with mentorship? What's it been like?
Just yeah, just agree completely. And I think the mentorship, much as you'd have one assigned mentor, I think you have multiple mentors even before you arrive at your site because there's someone walking through you through every step. There's a lot of support during the application process to for those who will be accepted. There's someone walking with you through all these steps. So there's continuous mentorship at every level, and the mentors are not just there for the clinical, for the pilot aspects, but even just the day-to-day living. Um, and coping with being away from home for a year and just having conversations and coffee once in a while. So that's great.
Yeah, I guess you make the distinction very nicely between a supervisor and a mentor. The mentor is not a supervisor. The mentor is very much as you describe, both you and Lenisa, somebody who's there for you and with you and goes along the journey with you. And not just during the fellowship year, but I'm sure you stayed in touch with your mentors down through the years and the years that have passed. So that's an important part of mentorship. It's bidirectional, but it's very supportive as well, and they're definitely not a supervisor. Isn't that right? Not a supervisor. No, no.
Yep.
So look,
Yep.
I think we're coming to the last question. It was really about for the two of you, maybe I think it might be helpful for people who are interested in applying on the webinar to just in terms of understanding a little bit of the day-to-day routine at Trinity, at UCSF. Obviously, they're similar. They're not different. They are different. They're not identical, but they're similar. So maybe Mataa, you might start. Just what's the kind of what's it like day to day over the course of the year? Maybe if you could kind of quickly run through that, the kind of the rough outline of the structure routine.
Sure. I think again, there's structure. There are days which are kind of heavy where you know that you're going to be sitting around a conference table, going through some didactic sessions and class type work, I think twice a week usually. But in between, you would always have something you're working on. So you would always be attached to a rotation essentially. So your day-to-day depends on what rotation you're attached to. Some would have you doing a clinical observership, or you could be in the pathology lab, or you could be doing any of the other activities, but there is always something that you are doing. But there's also a lot of space built in for you to work on your pilot, for you to work on other projects that you might have already come with, research, publications, all of that. And there's a lot of community activities as well in the campus. So some periods are busier than others. When the pilots kick off, they get
Yeah.
kind of busy.
Yes.
But there's always time for everything. It's just about how you balance it out.
Yeah. And Lenisa, what would you kind of a day in the life of a fellow at Trinity? What's it like?
It's very much like what Mata said. So we do have these sessions that are learning sessions. Many times we're using the computers and listening to the classes like that. But the other times we are together discussing in a table and talking about relevant topics depending on which area it is. It may be more active methodology, we found it very interesting whenever we had the opportunity to have these kind of classes. We have had many classes like that around the table discussing, doing creative active methodologies to learn more about the different perspectives in terms of dementia and public health advocacy. So there is a big variety of let's say methods that we are exposed to learn more about dementia, to learn more about public health and advocacy. And that's a very interesting part of the fellowship, the way we learn about the different areas.
Yeah. So a nice mix of structured, unstructured, there is free time, work on the pilots. But I think also, I think at both sides, there's a lot of collaborative opportunities, crosstalk, peer learning, and of course the mentorship and the clinical lived experiences. So it's a nice mix, it sounds like. I just before we finish, there's a couple of questions maybe I would try to answer. One is a question around um, someone interested in exploring interventions to support brain health in people with intellectual disability or developmental disability. Is that something relevant to brain health and dementia prevention? I would say yes. I mean, we look at life course brain health, and I think there are certainly there are experts and faculty at both sides who have an interest in that area, particularly areas like Down syndrome and intellectual disability. And obviously, these individuals have vulnerabilities in terms of their brain health, and interventions are very, very important. So I would answer positive to that. Yes, that there is there should be opportunities to explore that. It's not just focused on Alzheimer's disease and neurodegeneration, is life course brain health. And people with intellectual disability would also be in that risk category. I think we're kind of coming towards the end of the allotted time. And I just really wanted to thank everybody. In particular, I wanted to thank Lenisa and Mataa for making themselves available for the interview. Thank you so much. I think it's lovely to see you and talk to you again. I hope we can catch up soon. And thank you for that. I just want to thank everybody who has come to the webinar. Also want to thank everybody that's helped produce the webinar and supported this. So I think that there will be further information sessions, I think in August, which will deal with more site-specific issues. And I think a number of the issues that came up in the Q&A will very kind of more operational and very specific questions, I think, can be dealt with, on that site-specific basis. So I'd encourage people who have some questions, if the questions weren't answered, if you think you want to apply to UCSF, go to that session. If you think you want to apply to Trinity, go to the other session. And if you're not sure, go to both sessions, go to all sessions. And also, you can email at the address there if you have ongoing other questions. We will try and answer them. I think we have tried to answer some of these in the Q&A, but I think we can continue to try and answer some of the questions if you email us in the meantime. So I think without further ado, I'll probably just bring this session to a close. And again, thanks everybody for your participation.
Thank you.
Thank you. Bye-bye.